All right, Black Box Radio. We have Brian Sims today. Say hi to the people.
Hey, everybody.
All right. So can you just acclimate us on what you do professionally?
Sure. So professionally, and I never really know what hat I'm wearing depending on the setting I'm in because a lot of the stuff just it kind of overlaps. But professionally, I am director of quality and health improvement at the Maryland Hospital Association, and that's a bit of a mouthful, but basically, I work on quality policies to improve care for individuals throughout the state of Maryland, and additionally work on reducing health disparities and increasing health equity with hospitals and identifying partners to do that work. I also am the president of a nonprofit that I co-founded 5 years ago, the Greater Baltimore Health Improvement Initiative, and it's focused on empowering individuals in Baltimore to take control of their health through education, advocacy, and action. And then finally, and probably most pressing right now, I am running for City Council in Baltimore City's 7th District, which is Central West and Northwest Baltimore.
That was
That's a lot going on.
that's mouthful. But what you're saying though, in this times, health is a big issue, and people's prior issues or pre-existing conditions, as they call it, and
Mm-hmm.
also the ability for hospitals to service people has been definitely affected by COVID-19. So,
Absolutely.
how are you guys and what you do? What has COVID-19 kind of destroyed? What you guys do?
Yeah, so it has had a major impact. We have been working. So my office has officially been closed for 8 weeks now,
Wow.
and we have been working literally almost around the clock. I mean, I'm in front of a computer almost 12 hours a day between work and campaign stuff.
Mhm.
Primarily work right now, and again, because like I said, a lot of this work overlaps. The work that I am incredibly passionate about, addressing health disparities and health equity, I'm blessed to be able to do that for my job, my 9 to 5. And so a lot of this stuff overlaps, but I particularly have been working to address the vulnerable populations. How do we ensure that they continue to receive the care that they need in spite of the hospital's demands relative to the COVID response? So we've been working on that. In the first couple of weeks, it was addressing homeless populations and foster youth. And most recently, I recently worked with the American Heart Association on a public service announcement. Helping people to understand that if they have any kind of chronic illnesses, heart disease, any factors that might increase their risk of stroke, to please come into the hospital because we're seeing an increase in people who are dying at home and or having stroke and heart attacks at home because they're afraid to come into the hospital for fear of catching COVID. So it has had an impact. Obviously, we hear a lot about the impact on the frontline providers, the nurses, the doctors, and the other staff in the hospital, but it's having an impact on people who don't have coronavirus, but who are afraid to come in and get care. And so some of their conditions are getting worse. So is definitely a chain reaction, and a lot of things are connected to this pandemic.
Wow, you said something that most people don't consider is the ancillary effect of
Yep.
something deadly being present where we're in a hospital that services the deadly
Yep.
virus. So people don't want to go in I've just said that to someone today. You don't want to get sick.
Yep.
So this is not the time to be sick unless you have have something that's really
Right.
present right now. But you do not want to go in a hospital leisurely. Like some people use the ER as almost like their medical doctor.
That's their primary care.
Exactly.
Absolutely.
And that's not what you should do right now. But this is so amazing that you said that people are dying at home or not actually servicing their real conditions because they don't want to go near the COVID-19.
Right. And
That's
one of the ways, interesting ways that showed up, and this is why data is so important, and being able to look at numbers. Physicians started to notice that the emergency room volume for particular illnesses was down drastically. People didn't stop having heart attacks. People didn't stop having strokes because coronavirus hit, but yet those people stopped coming into the hospital. So what's going on? And I'll take this moment to say this: May is Stroke Awareness Month, National Stroke Awareness Month, and the critical thing about stroke is that your outcomes or your potential for a full recovery or a better recovery are based on how quickly you get care
Sure.
after signs of a stroke. And so it's important to get care immediately after that. And so that is something that a lot of providers and hospitals have been worried about. And we are working to make sure people understand that there are protections and precautions in place to keep them safe while they are in the hospital for care.
And I really think, Brian, per se, I am a healthcare professional. And
All right, I hope I know what I'm talking about then.
yeah, I am exactly. And I'm working on Saturday. Actually, I work.
Mm.
So anyway, but that has nothing to do with this. But
No, that's good.
what I'm saying is it's really hard to go through this process, and we have no federal response, because it would definitely help when it comes to these ancillary conditions. If we had an actual structure, or we were creating a structure, you can have hospitals in regions that are just for people who've had pre-existing conditions, so they can feel safer. You
Yep,
understand what I'm saying?
yep,
All hospitals
absolutely.
don't have to be the adjustment for COVID-19. You can
Right.
kind of fuel them, or move them to maybe 4 hospitals that are near each other, and then have this one outlier that is servicing more of people who have heart attacks or stroke.
Hmm.
So they just, we don't have this fear to get care. But
Right.
that, you would need structure. You definitely would need resources from the federal government, and you would need a real president. Let's be clear.
You would need real leadership.
Real
Absolutely.
leadership. You definitely would need real leadership. I'm not a fan of Hoagie, but he's doing a very good job responding to this crisis. Now, his
Right.
outlying policies, I'm not in agreement, but I definitely understand that he understands how to be a leader,
Right.
and
Yeah.
that's important. And what do you think?
Well, I think that's absolutely important. I do think that I would be remiss if I didn't call out the bad decisions that he made over the past 24 hours or so,
Yes,
vetoing the funding for the Kerwin and
and
also,
HBCUs,
and then the funding for
a more
HBCUs. And
elected
so
to help.
I think that is a huge mistake. And we all have been somewhat praising his response to the coronavirus pandemic. But see, part of that is because the bar has been set so low from a federal level that it's easy to look like a hero in times like this. And I think that that's something that we can't forget. So I do want to say that. However, we are fortunate that we have had competent leadership specifically related to the coronavirus response, even if there are some areas where we could point at as something different should happen. But it's always easy to be an armchair quarterback. With that said, I do think that a coordinated federal response helps immensely, because when you don't have, every state isn't fortunate enough to have various resources or infrastructure put in place. But the one thing I want to point out is everything you just said related to the coronavirus response in some ways that could have been handled with the right infrastructure and leadership is the kind of work that one of the things that I work on in my professional job. When we talk about access to care and access to healthcare and why certain populations don't trust the healthcare system as it currently exists, those are the kind of hurdles that we're trying to overcome. So the coronavirus pandemic is really highlighting a lot of issues that we've been dealing with for generations, related to lack of access, related to lack of trust, related to um, uh, uh, issues that are leading to these health disparities. It really is shining a light on these things, and I think that it'll be a missed opportunity if we don't learn as much as we can from these things that are being highlighted, and what are some of the things that have worked in the coronavirus response, and some of
Mhm.
the things that haven't worked, and how we can apply that beyond this pandemic.
Absolutely. We have to use this as preparation, because it won't stop. Viruses
Absolutely.
will continue. They've been here since the beginning, and they will always be here, and they're getting worse. And so we really, this type of structuring that we're kind of creating, I mean, because when states are competing for PPE and,
Hmm. Hmm.
and competing to try to get things for each state, then that's a big problem. That's why the federal partnership is so important. We don't
Yep.
have that, but what's happening in healthcare, I think, when it comes to the hospitals and even healthcare professionals, we're looking at healthcare in a different way. We understand that a lot of the stuff that we thought were like the hospital issue is really like regional.
Yeah,
It's
absolutely.
federal. We thought the hospital was just hope, but it's really a concerted effort from resources from so many municipalities, and it's a problem.
Well, to respond to that, you're absolutely right. And I think that one of the things that people miss is that when it comes to healthcare and health outcomes and these disparities that we're talking about,
Hmm.
only 30% of your health outcomes are related to your care in a hospital or a doctor's office or anything,
Hmm.
related to things that you don't have control over, genetics, things like that.
Sure.
So almost 70% is related to the conditions that you live in, the environment around you.
Yep. Yep.
And to your point, those situations and environments are created through policies and practice at your local level,
Hmm.
sometimes at your federal level. And so when I do this work, working with hospitals and partners to address health disparities and health equity, there's always this a bit of a tug of war of whose responsibility is it to address individuals in the communities that they live in. Is it the hospitals? Is it the state? Is it the health department? It's a all hands on deck approach, and I think that everybody has to participate in it. It's in the hospital's best interest to have a healthier population, especially
Hmm.
the way that they are reimbursed here in Maryland. And I just
Sure.
got a little too technical. I apologize,
But you're right.
but the system is created such that it benefits everyone for the population to be healthier. And so, and that is what I mean when I say identifying partners to do this work, whether that is the county executives, the city leadership, for-profit partners. It's across the board, and it's going to take an all hands on deck to really get some solutions that are sustainable.
Exactly, exactly. It kind of gets takes away the arrogance that we've had, like it's your problem. But we
Absolutely.
COVID-19 has shown if you don't clean those folks up, they're going to kill you.
Yep.
That's
Yep.
because we're all in this together, and that's why we have to do better. We have to be humane about policies. We have to be humane about how we give resources to different communities. Everybody needs to sit at the table so we all can be healthy, and that's the truth.
Absolutely.
So we're gonna move on because I'll be on that all day.
Sure. You and me both.
I'll be on that all day. I want to know, like, personally, how are you affected? I know you have your young children,
Yeah.
your family.
Yeah.
How has
Yeah.
COVID-19 kind of gotten to your
W-
personal life?
Well, the house can't stay clean, and and I realized. So I have two children, a 5-year old and a currently a 2-year old, but she will be 3 in a week and a half. So a 3-year old and a 5-year old at home.
Mm.
The first 2 weeks, probably not even quite 2 weeks, we were really sticking to a schedule, and we were like, "Y'all are going to learn at home." We had them on their Zoom classes and all that. We bought textbooks or workbooks for my son who's 5,
Hmm.
and all of that went out the window after about week 3 or so. And now we're just trying to keep them from screaming and chasing each other around the house. You mentioned earlier, people trying not to get sick so you don't have to go to the hospital. My daughter fell down the steps twice
Ooh,
in the first week, and it just terrified me.
oof.
And part of that was because I'm like, we can't afford to go to the hospital right now with everybody in there being sick. And so
Mhm.
it has been, I'm not even going to lie, it has been stressful trying to work and thinking that you can work, because my wife, she works full time as well. I work full time. We are working full time from home.
Mm.
My wife is my campaign manager. We are doing that around the clock. And so to do that and to think that we can homeschool too and try
Mm.
to keep a house together. So around week 3, we definitely realized that we had to extend ourselves some grace, and that things are not going to be perfect and it's just going to be like that. And, hopefully, someday soon, we can start to clean up and it'll stay clean and the kids can see their grandparents. The kids have been fine. They do miss their cousins and their grandparents. Zoom has been a godsend. At least they get to see each other.
Mhm.
But I think that, and I'm gonna say this too: the mental health toll, and this is something that you hear a lot of people talking about. And I know I just took it back to healthcare, but
Go ahead.
it is going to be immense. The
Mhm.
response that's going to be needed when we come out of this, and myself personally, I don't deal with any chronic or acute mental health issues that I know of. But we all have our moments. We all have, our moments. And I feel sometimes, just feeling like just wore out. And I think that, you know, it is having a toll. And I think that we have to acknowledge that, and we have to be okay with saying we need help, okay with saying that we need a minute. And so that has been the biggest toll. That and just eating.
Well, you know what? I think what you said is so amazing because my biggest thought, and people might come for me, but I just think that rushing these kids to school and rushing people back into telework or whatever we're calling this is a disservice to the human population because we have not unpacked COVID-19.
Yeah.
And I'm not saying that kids should not go to school. I'm not saying that we shouldn't work. That is something we should do. But this is not normal. And we're trying to go on as it is normal. It is not. And when you try to make something normal that isn't normal, that's psychosis.
Yep. Yep.
So now you introduce mental health that you don't need to have when you just deal with it as it is not normal.
Right.
But again, leadership has to do that, has to give you proper messaging and also proper resources. Like Canada. Canada is giving their folks $9.80 every 2 weeks.
Oh, wow.
I mean, it's amazing what Canada's doing I mean, it's a smaller country, of course, but still, they understand that the pressure of money and $9.80 is not enough to take care of a lot of families, but we're not doing much now.
It's better than nothing. All of these food drives and things that are happening out there that a lot of people are doing, that 980, if people have access to be able to spend it correctly, it would change it. It would change so much.
It would change it so much. So you just need a lot in place. We got to look at the tool called voting, because we need leaders with empathy and structure. We need to have that, but we also need to look at structuring this country in a fairer mode.
Yes.
And if we did this, then when we get to this point, when something comes into our society and kind of exasperates everything we do and takes away all of our norms, we're able to recover and deal with our children and our lives. Now everyone is just trying to live into this box of being normal, and there's no such thing.
Right.
So don't fault yourself for having a dirty house. Everybody's house dirty. I'm glad we're not on Zoom.
Oh, look, we wouldn't be. I would have one of those virtual backgrounds.
Me too, bro. Because it's serious out here. It's serious out here, and you cannot address everything. You tell people you got 3 kids, they all need to be on a computer doing their school. Then you need to work. You need to make sure they're structured. That's a lot.
Absolutely.
So I understand what you're going through. I'm glad I'm not going through it.
We all have our struggles. I was telling somebody earlier today that does not have small children. Like, man, I don't know how you do it. I'm like, you know what? Everybody has their own issues. That's stressful, but the smile that they sometimes bring to your face is something that if you don't have them around, you won't know that feeling either. And so it's a balancing act. I don't know how long that, this can go on, but we are managing. And, fortunately, the kids understand what's going on as best as they could. And so they are actually enjoying this, I think.
Well, humans at some point, what we do over repetitively becomes our behavior.
Yeah.
So even though this is so chaotic, but we're starting to, I see people outside regularly now with gloves and masks. I mean, we're regularly functioning in this now. And as we go on and on, we will find ways to cope. And that's what it is. So I want to read what Canada closed schools for the rest of the year, froze mortgages and rent, gives out $9.80 every 2 weeks.
Oh, wow.
And the people only have to pay their utilities. What?
Yeah. See, and I think
they change this country. Just talk to me.
I think that you said something earlier, and I think that's going to be the first step. And I don't know if we'll see it in my lifetime or our lifetime, but you have to build a sense of humility into your practices and your governing. There are a lot of great things that are happening in other countries around the world, but we here in America for so long have just adopted this, America is so great and perfect and everything. And the problem with that is it doesn't allow you room for improvement. If we adopt that mentality in our everyday lifestyle, if you are someone who works out or you're somebody who goes for a run or you're an artist, if you wake up every day and tell yourself that, I mean, I don't know, different things for different people, but if you wake up, for me, if I wake up every day and tell myself that I'm perfect and I'm the greatest at something, then what is going to be my motivation to improve? What is going to be my motivation to look elsewhere to see if they are doing something better, and how can I adopt that? We
Sure.
don't do enough of that in this country, and that's one of the problems I have. Every time I see this, America's the greatest, America. First of all, as a black man in America, I think that
Not
is
great.
something that we have never been able to adopt. And when I do see somebody adopting that mentality, and a black person in particular, I find that to be a little bit curious, and I'm not judging. I would like to hear more, but to say that we are so great and so perfect, it's to ignore so many of the issues we have, and I think that comes with humility. I think that comes with saying, yeah, we're pretty good at things. We are a great country, or we can be a great country. But you know what? There are great things going on in the world. What can we find and improve on? I
Sure.
think that's the mentality we need, and until we adopt that, I don't think we will. A lot of these things, we're just going to keep spinning our wheels.
We got to try new people, though. It's the truth. No one wants to talk about it, but this country can be governed by all people, not just old white men, and it's the truth.
Oh, 100%.
We
And I
have
think,
to change the dynamic of who is governing, because there's different people in the world. We got to get new perspectives. If we don't, we're going to perish, and we're seeing it. It's live in action right in front of us.
yeah, I think the lack of imagination in what a leader can be, I think is a challenge that we have to overcome. I grew up in a household with four sisters. I was in the middle, two younger, two older. I'm
Wow.
married to an amazing woman. The conversation around, first of all, the fact that people would even have that conversation, the fact that people thought it was okay to have a conversation about whether or not America was ready for a woman president, or whether or not they could accept a woman president, I think it shows the problem right there.
Yep.
It's a lot. Like, we imagine how ridiculous it would be if somebody said, "You think a white man can run this country, or a white man can be the CEO of this country?" They would look at you like, "What are you talking about? What do you mean?" But to ask in 20 now it's 2020, to even ask that question and to feel comfortable saying, "No, you don't think that you're ready for, or this country is ready for," then you're acknowledging that there's a problem in this country. And I
Mhm.
think that you can't just say that and not figure out how to solve it. I mean, yeah, I'm running for city council in Baltimore City, and I think that that doesn't mean that anybody should be precluded from the opportunity to seek elected office. But I think that to say that a woman is not qualified for an office because she's a woman, I think is a problem. I think you're missing the whole boat. Just like saying that a woman is qualified just because she's a woman, I think you're missing the point too. I think that everybody should be evaluated on their merits. And I think that women have shown time and time again that they are more than qualified. And I'll be the first to say that.
Well, I second that notion, but definitely second that notion. But truthfully, it is a problem when the quantification for leadership starts in your gender.
Yeah. Yep.
Let's be clear.
Yep.
Leadership has if the quantification of it starts in your gender, then we first have an issue.
Right.
And that's a problem. But okay, a lot of problems in the US. So we can go on and on.
We could go on all day
Okay,
and solve none of them. But I mean,
none of them.
and here's the thing, and I want to say this: the solution to a lot of our problems.
Mhm.
I'm not an engineer, but the solutions to a lot of our problems, the infrastructure, the systems, they exist. But what we often have is a lack of will to implement, a lack of will. And so the humility part we already talked about. So that's a problem too. But then we have the lack of will, and I say that because in working to address health disparities and health equity, and we mentioned earlier, there's always this conversation of whose job is it anyway?
Mhm.
Oftentimes what's missing and what's lacking is the will to acknowledge racism and how that plays a role. The
Mm.
will and the willingness, the will to say, you know what, this has been a problem for far too long. We know what has worked elsewhere. It's time to try it. There often isn't that. You have to wrap the issue and the solutions up into a nice, neat bow, or bury it in a cookie, and we just can't be open about it, and you have to play that game, and I think that's part of the frustration with folks, and honestly, that's one of the reasons I'm seeking elected office, because I do have some knowledge about some of the things that work and some of the systemic issues that have led to some of the disparities we see in the city, and we just need more people in positions of leadership that A, understand that, and B, have the will to do something about it.
Mm. Well said. Well said. All right. So we're at the part of the interview where we do the LWT. That's the last will and testament. And that's where you leave something inspirational with the folks. So we want to hear Brian's jewel. Leave a jewel.
My jewel is this, and I think you hit on this earlier, and you said something a couple of times that that resonated with me, and I've been saying this a lot lately about leadership is compassion. And living in Baltimore City, I have, it is an act of love, and love is not always a feeling or emotion. Sometimes it's a verb. It is a practice. And I think that, I would like for us to see us to, as a society, see the humanity in each other. We're not perfect, but, to just believe in humanity and see the humanity in people, even their imperfections. And I think that, what worries me is that while we are afraid to come within 6 feet of neighbors and strangers and even family and friends now, I just really hope that is not something that persists after this pandemic is over. And I want to see us embrace one another more so than we were even before this. And I definitely don't want to see us come out of this and less willing to embrace one another. So I just ask everybody to practice the physical labor of love for your neighbor and to view the humanity in one another.
Awesome. Awesome. G?
Brian, thank you so much for sharing your perspectives on both the macro level and the systems and the micro levels of the way that you're dealing with the situation in your home. We really appreciate you adding your voice to the Rona Report.
Absolutely. Thank you all for having me. This was a great conversation. I appreciate what you all do, and keep it up.
All right. If you are listening and you enjoy this conversation, you can find all the voices of the Rona Report at blackboxradio.com. That's BLAKBOXXRADIO.com. You can also find Black Box Radio on Facebook and Instagram at Black Box Radio. And you can find us on Twitter at BoxBlack. That's BOXXBLAK. And if you're hearing this message now, we need your help to help us spread the word. These reports are being suppressed on social media platforms. So share them with your friends and family, send a text, send an email so that everyone can hear these important voices.
All right. So you're in that Rona Report. We just spoke with Brian Sims. He is a candidate for City Council in District 7, right, Brian?
Absolutely.
All right. And we appreciate you. We appreciate your input. Great conversation. Thank you so much.
Thank you all. I appreciate the opportunity.
So it's 5/8/20. We're in that Rona Report. Black Box Radio. We out.